So welcome to class. You are welcome to lesson 1, CCMAS VTP 503, pregnancy and parturition in domestic animals. First, let's look at the outline of the causes of dystocia in animals. And dystocia can mainly be caused by two reasons. One, maternal, two, fetal. On the maternal side, dystocia can arise due to failure of expulsive forces and the inadequacy of the birth canal. On the expulsive forces, mainly, again, there are two main reasons: uterine inertia or the abdominal failure of the abdominal muscles. Under uterine inertia, you have primary causes or secondary causes. Under uterine inertia, we have failure of the uterine muscles to contract and expel the fetus, or can arise due to diet, or you may have uterine rupture, or you can have uterine torsion. And on the abdominal muscles may fail due to age, debility, or lack of vital minerals. And on the birth canal inadequacy may arise due to immaturity or due to the nature of the breed of the animal, or even fracture or some diseases. And on the other side, the inadequacy may arise due to narrowing of the birth canal due to failure or dilatation of the birth canal. And that can start from the uterus up down to the vulva, where due to uterine torsion, the uterus may not dilate, the cervix may not quite dilate, the vagina may also fail to adequately dilate. This could arise due to hormonal reasons, or where you have the vulva due to some previous lesions that have failed to heal very well. And also on the fetal side, the fetus can cause dystocia, one, due to fetal oversize, which can be absolute or relative. You can also have faulty fetal disposition that may arise due to failure where faulty presentation, position, and posture. And this can happen either in anterior presentation or posterior presentation. And having now reviewed the causes of dystocia, we need to look at what indices that we may need to consider to see if you can predict dystocia in animals. External body measurements that could be used in estimating the pelvic capacity are very vital in that regard. And these are some of the indices that may be required for body measurements. First, height at pin bone. You can also look at the height at the hook bone, then the rump length. Then you can also see the heart guts and the height at withers. All these indices are very vital when reviewed in predicting or estimating the pelvic capacity, and by extension predicting the chances or dystocia, whether or not you need to supervise the parturition process. And in dealing with parturition process, parturition cases, these are some of the procedure or checklists that need to be approached. First, the assistance required, then which is usually a minimum of 3 for bovine. Then the restraint, the animal must be properly restrained. You need to adequately sedate the animal. The uterus must be well relaxed. So you need to administer drugs for uterine relaxation and proper epidural anesthesia to ease pain. And then you need to have some equipment that may be required. Then review the case history adequately to prepare you before conducting general clinical examination of the cow. In the general clinical examination of the cow, you also need to do the vaginal examination to determine the position or the orientation of the fetus, and then examine the fetus itself and see its position, presentation, and posture. And having done that, you need to have excluded this restraint, sedation, uterine relaxation, epidural anesthesia, equipment, case history, general examination, vaginal examination, and examination of the fetus. And after this, we can now, before we go further, identify the orientation of the fetus and determine whether it's alive or dead. And the evidence of life, of fetal life, includes 1, pedal and palpebral reflexes. The presence of this indicates the fetus is alive, and responses to pressure on the eyeball or pinching of the nose or ear. And then suckling reflex, when you place the fingers in the mouth. Then anal sphincter reflex, when you place the finger in the anal, insert it. And then spontaneous movement of the fetus. Watch out for also ocular mucous membranes. It should be pink. And detection of fetal pulse. And then detection of fetal heartbeat. And finally, detection of fetal oxygen perfusion. And if you can't find this, then you have to establish the evidence of fetal death before concluding. And that can be done by absence of any positive sign, any of the 9 positive signs listed. And then look at blood stains of the amniotic fluids. And then look at the corneal opacity, which usually occurs 7 hours after fetal death. And then autolysis, that's sterile or with putrefaction, where they may be smelly. Having done this, then look at the generation of separation and separation of the fetal placenta with loss of fetal fluid.